The healthcare system is fragmented, especially when it comes to integrating technologies across geographical boundaries. As digital health solutions become more prevalent in Australia, how do we extend these innovations from outside of Australia into regions like the Middle East? Think about all the tricky things like navigating the complex healthcare systems, different regulations and cultural norms. And if you actually do go global, how do you maintain integrity and efficiency of your health tech solutions? With me today on the show is Thom Soutter from Synapse Medical Services. And in this episode, we talk about the international endeavours of Synapse Medical Services and their unique approach to healthcare financing systems. We learn about Advanced Health, an industry community initiative in the UAE that's bridging gaps in the healthcare ecosystem, and lessons and pitfalls to watch out for when taking your health tech solutions into different jurisdictions. Collaboration starts with a conversation, Team Health Tech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare. G'day, Tom. How you going?
Yeah, very good, Pete. Thank you very much for having me.
Thanks for joining at I like to say, a mutually inappropriate time for both of us. You know, when you're getting both sides of the globe, it's just slightly, out of hours on both. But thank you for making the time for the chat today. Because I guess you would say long-time community member and first-time podcast appearance, right?
Yeah, absolutely. So long-time listener, avid listener. Your dulcet tones have accompanied me on many a dog walk, exercise class.
Walk. Gotcha.
Yeah, washing dishes. So I'm delighted to be here, and thank you for having me.
I'm sure there's some kind of psychology thing that people associate my voice with, like this menial task they perform while they're listening to an audio podcast. But maybe they get out and about these days, or they watch on YouTube now, which is a subtle plug to subscribe to the YouTube channel. But for those that aren't plugged into the THD Plus community or don't know of you, Tom, firstly, give us a bit more context about you and what you do.
My name's Tom, Business Development Director at Synapse Medical Services. So we are a medtech company spanning various jurisdictions now, originating from Sydney, focused on healthcare financing, healthcare administration, basically making things easier with our technology. Myself, so hopefully this is a little bit different for some of your usual conversations. My background is not health, so this has been a wild ride for me over the last sort of 7 years of being with Synapse. So business development manager, director for the last 15 years. I had to work that out early. It's my birthday this week, so that scared me when I realized how long I've actually been doing this. But legal background, and then moved into medico-legal, and it's been a gradual progression to the real stuff, digital health, which I've been in for probably the last 7 years. So originating from the UK and then working overseas in Dubai and then Australia, and then here we are. So an experienced business development professional, I suppose, these days.
Yeah, no, look, I love that you've got that experience and breadth across different parts of the globe. Like you say, experience, like obviously a good understanding originating from the UK and the healthcare system there, and working from the UAE as well, and quite involved in Australia. So I think we'll get into that in a little bit more, but help us understand Synapse a little bit more, because you mentioned medical administration and there was a bit around the finance side, and you come with a background of medico-legal too. So I guess it's all interesting bringing it together.
Yeah, so we originally, Synapse is 14 years old now, which we were working out recently, which is, and it's been a heck of a journey for Margaret Foe and our management team in the last decade in particular. So we've transitioned from, I suppose, what you traditionally describe as a revenue cycle management company. So, specializing in medical billing as a service, clinical coding as a service, medical transcription. Margaret, who I know has been on your podcast, started just doing the billing for her husband, who's a leading rehab physician, and it sort of grew from there. And then what we've done over these past few years is transition to still having those services fundamentally at our core, improving efficiencies, health financing systems, heavily around compliance. Moving to med tech, essentially. So we have key technology that's wholly owned for each of those services. So we have a leading comprehensive billing app in Australia where doctors can bill directly from the palm of their hands to the funds, to Medicare, etc. Clinical coding, we have an automated coding tool. Transcription, the same. And then an education academy around these things and doing them compliantly. So I suppose for us, what we want to do, the passion is the sustainability of health systems across the globe now, and I know we'll come to that. And we just want to make things efficient, reduce a lot of the wastage, reduce a lot of the sort of fraud issues that are within every health system, whether that's knowingly or inadvertently, and improve that whole process. More money to go around on the things that matter.
And it's been a while since we've talked about clinical coding had a robust conversation around clinical coding on the podcast. It's fascinating in itself in the, you mentioned originally Synapse starting and I guess like that outsource model, because it's correct me if I'm wrong, it's in a hospital setting, so much process and control around like what happens after a patient sees the various clinicians and has tests, because it's all got to be coded up. And like to get it paid, it's got to be retranslated into this complicated process. So I imagine a lot of groups would look to outsource that, but it's interesting to hear that, you're not just providing the service on behalf of them, but now built out these technologies to go that next level and do it almost in a more scalable way. Am I kind of on the right track there?
I think the thing is that we've built technology to aid clinical coders. We're not trying to remove them. We love clinical coders. We still have a team of them. Heather Grain, who's our coding manager, is one of the leading coding educators and coders across the world really now. But the problem that we found, and this is something fundamentally in Australia as well as the Middle East where we've worked, is there's just never going to be enough coders, right? There's not that huge influx of people training in it. There's a shortage, and that means that there's backlogs, benchmarking issues, problems with reimbursement. So it's to try and supplement that. And I think what you don't realize until you're involved in it is, you touched on it there in yourself, the complexities of it. Even the most experienced coders will disagree on certain points. There's a lot of training that goes into it. It's incredibly convoluted and detailed. So to try and build some technology to support that, particularly with smaller facilities that might be in the back of beyond, particularly in Australia, it just all builds into that, the financing part being a lot smoother, turnaround times being quicker, getting to your revenue quicker, having more visibility on what's actually happening in your facility. So it's much more critical than I think people realize when they're initially discussing the topic.
Yeah, and I from what I know, it's a tight-knit, niche little community, that of the elder clinical coders within the hospital setting, and rightfully so. That as you mentioned, the expertise level is kind of off the chart. I'd imagine that if you're building technology to support that service, there would have been a lot of time and effort involved in building that trust and credibility with that community. Otherwise, they just wouldn't accept it, right? Absolutely.
And I think we're moving away. It's like you said, it's been a long journey. We're moving away from coders being stuck in the basement of large facilities and trying to modernize that, particularly for certain specialties, and making things a lot quicker. And it might be, look, there's an 80-20 rule that 20% of coding may always need that manual review or checkpoint because it's so complex, right? People go into hospitals, they're there sometimes for weeks on end, incredibly complex illnesses and diagnoses that come along with that. So what we're trying to do is shift some of the resource and workforce, so perhaps your coders can concentrate on that while the rest of it's being done for you. So saving time, resource, frontline care is improved. So absolutely. And you have to build that trust and go on a journey. And I think we've been building this AI machine, if you will, that's, based around NLP, but not solely on that. It applies coding rules, algorithms for the best part of a decade. And we launched AirCoder, as it's known, into the Australian market first in December 2019. And then we've been on this sort of weird and wonderful journey with it since, where people pop up in, Kenya, we need this, or Saudi Arabia, or we now have resellers in America and the UAE, which is where I'm based in our Middle Eastern office. So it's fascinating really that healthcare systems, as you know, are all very different and all on a different path with their digital journey, but fundamentally the problems are the same. And it can be adapted and scaled depending on what that jurisdiction requires, or what code set they're using, or what potential backlogs they have.
I was going to go down an AI rabbit hole, but then you also brought up the point around this global acceptance or the need in different jurisdictions and parts of the world, and that probably ties in a little bit in terms of utilizing technology. There's just not enough coders, and the scale, the breadth of the issue is too big for any kind of nation to deal with in some part. Maybe specifically talking a little bit more about the UAE, because you've been there for a while. Of all the places you could be based, you're in the United Arab Emirates. Tell me a little bit more about why there and what that's like.
Well, I think we started by trying to find a time that was mutually bad for both of us to start. Look, I can completely relate to that. A lot of the team that report to me on the BD side are in South India, our wonderful Indian office, which opens a lot of doors for these international opportunities, and I'm happy to talk a bit more about that. Then obviously the Middle East, Australia. So time zones, I know it well. I know the problems of finding those convenient times very, very, very well. I think in terms of the UAE, look, we've had an office here for the last 7 years. We moved here. That one of the things that we're really trying to do is spread that Aussie word, that Aussie knowledge and that Aussie know-how. And we felt that we had technology that could help in certain jurisdictions. Dubai, the setup process for our office there was reasonably straightforward. We already had an office in India that's wholly owned as well. So it made sense in terms of time difference and geographical location there. And then we've been looking at opportunities and building those relationships in the Middle East now for the last 6 or 7 years. That ultimately, and it's been an honor for me to head that project. I mean, it's been fascinating and a wonderful journey for us. And now there's things like we're working on a national infrastructure project in the Kingdom of Saudi Arabia, developing their non-admitted case mix classification, which is huge, right? Because coding outpatients, all of that piece of work, which is fascinating, and trying to build that, and it's something that could then potentially be replicated internationally. So we're halfway through or ongoing with that project at the moment. So I think the Middle East has opened many doors. And like I said, because of its geographical location, there's a lot of different avenues that you can then go in the region, look at other places internationally. So yeah, I think that's a big thing for us, and spreading that Aussie word. For me personally, it's got a lot to answer for, because I moved to the Middle East as a single gentleman and now married, baby, dog. So personally, it's been a hell of a ride. Yeah, exactly.
That's fascinating around the system-wide implementation. So we're not just talking about, in Australia, we'll talk about not just implementing in a local health district where you've got a few different hospitals. You're talking about the entire healthcare system, right? That's not a small amount of work to
undertaking.
Yeah,
no,
right?
absolutely not. And I think the things that we learned quite quickly is that the Australian modifications for things like this coding have been adapted in certain countries in the Middle East, Saudi Arabia being one of them. Every country has different infrastructures. In the UAE, you have the Dubai Health Authority, and there's different government entities in Abu Dhabi. The 7 Emirates sort of working collaboratively, but all have their own ecosystem. And then obviously in Saudi, it's a huge piece of work in terms of there's different clusters, and just the size of the country there is so vast, as you say, that and they're developing at a pace, and they're developing their health systems digitally very aggressively.
You mentioned you're well entrenched there now in terms of Dubai and building up that network, and you also got there's a few parts within Synapse around education and everything, but there's also this stuff you do with advanced health as well. Tell me a bit more about what that is in particular.
So look, advanced health is something that I personally am very proud of. So when we were setting up Synapse in about 7 years ago in Dubai, what we realized is that although we were in a place called Dubai Healthcare City, which sounds very grand, and you think you're going to walk in there and it's going to be paved with gold and you're going to meet everybody that you need to know in the healthcare system, in reality doesn't quite work like that. And what we realized quite quickly is that there wasn't a huge plethora of networking events or healthcare events where you could meet the right stakeholders, develop things organically as perhaps you'd like to in Australia, with the fantastic work that you guys are doing. There's nothing like that there. So myself and a friend who's also involved in the healthcare sector, but more from a pharma point of view, we decided that we were going to try and create something ourselves. So Advanced Health was born, and the third partner is a business ecosystem called Dubai Science Park, which is another one of the business parks in Dubai. And what we wanted to really do is just put on free events that were educational, touching on different topics each time, things that, have nothing to do with the day job of Synapse. So we've covered 3D printing. Obviously, we did COVID, rare diseases, whatever it might be. And just get people where people could come and listen to key speakers from the field, and then learn. And then also it would become its own ecosystem. So I think we've done about 28 events to date over the past 5 years, always in person. COVID aside, we get about 120 delegates to each one. And it's become its own thing now, right? So Advanced Health is its own brand. People come to each session because they'd like to see familiar faces and learn about things that are on trend at the moment. And then obviously we also get new people that come for that specific topic. So the last one was on AI, for example, which everybody's talking about at the moment. Yeah. So it's grown into something that's wonderful. And obviously the aim for us is to host these events and then business will grow organically off the back of that, which is what we found. And obviously the Dubai ecosystem is not the largest, so you soon get to know people and then people know who you are, and that's obviously all what we're trying to achieve. So it's been very good for us in that point, and learned a hell of a lot along the way, because obviously a bit like the content that you guys put out is not everything you come across on a day-to-day basis.
No. Well, I can see why it makes so much sense for you to get along so swimmingly and be aligned with the vision from Talking HealthTech side, because there's a lot of similarities in terms of why it exists. But that's super important, as you say, particularly if I think from, say, if I was an Australian organisation looking to expand into other parts of the world, you might, the mind might automatically take you to, let's expand into the US or the UK or, even into parts of India or Asia. But for those that are thinking about expanding into our other parts like the UAE, like what kind of opportunities might exist, or like any kind of recommendations or thoughts that come to mind for those that might be contemplating?
I think it's a fascinating time, and now's probably the right time to do it, because the regulatory side is catching up with the technology and everything is being aligned. There's very streamlined processes for business setup, the direction that they want to take the healthcare sector in. They have the ability, unlike, I would say, potentially Australia and the UK, to get things done quickly. If it's mandated, this is what's going to happen. This is the route that we're going to go down. There's a very good collaboration between public and private, and it's open for investment. There's various different business parks or opportunities where you can see the right setup for you. Dubai Science Park was perfect for us in that regard, in terms of flexibility of license, services offered. So I think it's only going to continue to grow. The UAE in the 10 years that I've been there is unrecognizable, and they're certainly not stopping now. Right. And the same with Saudi, and the same for that whole Gulf region. So I think if you tap into one and you have the right partners, then it just opens a lot of doors very quickly that perhaps islands, should we say, like Australia, the UK or whatever, might not maybe have those opportunities. Or there's very different layers. There's historical layers of management and government levels there that have to be satisfied, whereas in the UAE things can potentially happen a bit quicker if you've got the right product. But what I would say on that is it's absolutely not a plug and play. You're not just going to take what you've got in Australia and replicate it. You have to do your market research. You have to find the right partners. You have to be willing to spend time on the ground and show that you're committed. But I think that there's huge opportunities in terms of hospital development, medical devices, even some of the conferences and everything that's happening there. So, and I think we've started to notice that. Austrade are big fans of ours in that region and big supporters, and there's more and more Australian. I was at the Austrade dinner this January, and I've been there for like the last 8 years, and there was a lot more Australian companies this year than any other, and I'd expect that to continue.
When I think about, expansion into the UAE, I think about really forward-thinking innovations or grand devices, or, kind of something a little bit more progressive than what we might immediately adopt in Australia. Do you see that on the ground, or am I thinking about somewhere else? Perhaps I'm probably thinking a little bit more around Israel as well, obviously. But
there's been ties. Yeah, there's been ties strengthened there as well recently, which is huge. So I think I think the key difference there is that you can come over, and if you know the right people and you speak to the right people, you're directly then speaking to the government officials and the people that you need to. So you have that kind of direct line, and there's lots of people like Austrade, for example, and people that are willing to help you. There's a lot more international events taking place. So you can go and dip your toe and maybe listen to some of the speakers and listen to some of the innovations that are happening. They're trying to develop the country as a research platform as well. So I think it's very exciting, and I think there's a lot happening. And to be honest, that's one of the things with advanced health. We've almost become a bit of a conduit for people entering the market. Learn from our mistakes, learn from our successes. Who do I need to speak to? How can I help with that? And I think that's all part of the process. So it's a very vibrant sector in that regard, and a lot of the people living there, myself included, aren't from there, right? So you have that willingness to help people. It's not this kind of, I'm all right, Jack. It's, we've been through this. How can we help you, and how can we grow this together?
Fascinating. And I imagine then, like you say, that there'd be a lot of learnings that you would take, and it's great that you've got that global perspective too. If I was to apply that back to Synapse now and think a bit more forward, facing about where some growth opportunities might lie, what can we look forward to seeing from Synapse?
Yeah, it's a really good point, and it's a really exciting one, because, like I said, I've been at Synapse for 7 years, and Margaret and the management team have been building this thing for double that, and we still feel like almost we're near the beginning. There's a lot of exciting things to come. I think in terms of the platforms, we've got new versions of our billing app coming out at the moment, that we help sort of thousands of doctors and facilities around Australia, but there's a lot more that we could do there. We're always looking for the right partnerships. We have full APIs available, all to the relevant standards. There's a lot more that we could do in terms of growing that platform, and the sky's the limit, particularly in Australia there. And then with AirCoder is really exciting because it's potentially, it is international. Like I said, we're using it in the UAE, Saudi Arabia. We have agreements with resellers for other countries as well, Kenya being the most interesting one perhaps, and moving into India as they're developing their benchmarking of coding and standards and how they deal with that. So really exciting. And again, huge growth plans. We're speaking to relevant people at the moment. We have a couple of exciting partnerships to announce in the next couple of months, and one at home in terms of Australia and one internationally. So I think for us, it's just, if we can help people with these technologies, we're more than willing to have the conversation, and we're always looking for those partnerships and to develop those relationships built on trust.
That could be a good point to land on, but to close out the conversation. But I can't go past and wonder, working in Kenya, what's that like? Just in terms of just opportunities to really. I hear of stories of, leapfrogging, legacy tech and moving into more advanced technologies right away and solving big problems at scale. Talk to me a bit more about what's happening in Kenya.
Like all of the healthcare systems that we work in, they're all at different degrees of development. So, and particularly in the areas of financing and revenue cycle that we're operating in. So they're all government mandates coming through at the moment. I think what I would say that we've hopefully done in the right way is find the right partner. So, with some of these places like Saudi or Kenya, we don't have an office on the ground ourselves, but we have a trusted partner that's then going to develop that with us, who has that market know-how. So that's the way that we went through that. And then you're trying to navigate the regulatory and the government side. But if you've got somebody advising you of that, then there's lots of opportunities, because everybody is trying to get their data into a unified format that can be used. Everybody is trying to do that in the right way. So it's just some are further ahead than others. And in some of the jurisdictions where it's more of a nascent healthcare system, it's actually more exciting because there's so much development that can happen. And we really feel we've got the tools to do that. So I think watch this space, particularly with AirCoder. Like I say, there's just so much more that can be done there.
What a great position to be in, and really looking forward to watching that journey. Thom, I'll put the details for Synapse in the show notes of the episode for people to check out, and in the comments down below on YouTube, and to reach out to be part of Advanced Health if they're looking to do stuff in the UAE, or just generally learn about the clinical coding space more geared towards Synapse. So Thom, I really appreciate you making the time.
No, my pleasure. Thank you very much.
For more content and community about technology and healthcare, visit talkinghealthtech.com.